Welcome to the Trauma Informed Care presented by the Staff Development Department of the Behavioral Wellness Center at Girard. In this module, you will learn how trauma impacts behavior and how your daily interactions can support healing. In behavioral health settings, trauma is not the exception, it is the norm. This means every interaction you have can either promote safety or reinforce distress. Throughout this module, we will define trauma, discuss ways trauma shows up in behavior, apply trauma-informed principles in real time, and how to adjust your language in interactions to reduce escalation. Let's explore what is trauma. Trauma is a psychological, emotional, or physical response to an event or series of events that is experienced as deeply distressing, overwhelming, or threatening. Simply stated, trauma happens when something is too much, too fast, or too overwhelming for a person to process and cope with. Let's explore key elements of trauma. An element of trauma is overwhelming, meaning the experience exceeds a person's ability to cope. It is threatening. It may involve a real or perceived danger to safety or life. It has lasting impact. The effects can continue long after the event is over. It is also subjective. What is traumatic for one person may not be for another. There are many different types of trauma. Trauma is not one size fits all. It can show up in different forms depending on the intensity, frequency, and context of what a person has experienced. Understanding these types of trauma helps us better recognize what our patients may be carrying. Let's look at 4 common types of trauma. Acute trauma can result from a single overwhelming event. This could be something like a car accident, a natural disaster, or witnessing violence. Even though it's one event, its impact can be significant and long lasting. Chronic trauma occurs when a person is exposed to repeated and prolonged distressing experiences over time. Examples include ongoing domestic violence, long term medical illness, bullying, or living in an unsafe environment. With chronic trauma, the body and mind are constantly in a state of stress. Complex trauma involves exposure to multiple traumatic events, often interpersonal in nature and typically beginning in childhood. This might include abuse, neglect, or instability within caregiving relationships. Complex trauma can be deeply affect a person's sense of safety, identity, and ability to form relationships. Systemic trauma refers to trauma experienced as a result of larger social systems and structures. This includes racism, poverty, community violence, discrimination, and generational trauma. These experiences are often ongoing and can impact entire communities, not just individuals. It's important to remember many of the individuals we serve have experienced more than one type of trauma. These experiences can overlap and compound, shaping how they respond to stress, relationships, and care. Remember, recognizing the type of trauma is not labeling. It's about increasing our understanding, empathy, and ability to respond in a trauma informed way. Trauma prevalence. It's important to understand this. Trauma is not the exception, it's the norm. Research consistently shows that a significant majority of individuals receiving behavioral health services have experienced trauma at some point in their lives. In many cases, that trauma is ongoing, complex, or has occurred over long periods of time. However, trauma is not always documented in a patient's chart. Some individuals may not disclose their experiences due to fear, shame, stigma, or simply because they have never been asked in a safe and supportive way. That's why trauma informed care shifts our mindset. Instead of asking what's wrong with the person, we begin to ask what might this person have experienced. By assuming trauma may be present, we approach every interaction with greater empathy, patience, and awareness. This helps to reduce the risk of re traumatization and supports more effective, compassionate care. In short, don't wait for confirmation of trauma. Let that awareness guide how you communicate, assess, and respond to every patient. Trauma responses. When trauma is triggered, the brain doesn't pause to think, it reacts to survive. In that moment, the brain shifts from thinking brain, responsible for logic and reasoning, into the survival brain. This system is fast, automatic, and designed to keep us safe. The challenge is that it reacts not only to real danger, but also to reminders of past trauma. Let's look at five primary survival responses. Fight. This can look like aggression, yelling, irritability, or defiance. The body is preparing to confront the threat. Flight. This shows up as avoidance, leaving, refusing, or escaping the situation. The goal is to get away from danger. Freeze. This can show up like shutdown, lack of response, or disassociation. The body becomes immobilized, like playing dead. Fawn, this is a people pleasing response. It may look like over agreeing, apologizing excessively, or trying to keep others happy to avoid conflict. The person is attempting to stay safe by reducing tension and gaining approval. And lastly, flop. This is a deeper level of shutdown. It may look like extreme passivity, low energy, inability to engage, or appearing checked out physically and emotionally. The body essentially powers down as a last resort survival strategy. When we think about trauma responses, it's critical to understand that these are not choices. These are automatic biological survival responses. They happen before a person has time to think. So when we see these behaviors, we shift our lens, not what's wrong with you, but what happened to you. These responses are the body doing exactly what it was designed to do: protect and survive. Our role is to create safety, reduce perceived threat, and support regulation, because only when the brain feels safe can it return to thinking, learning, and healing. Now that we understand what trauma is and how the brain and body respond, the next step is learning how to recognize these responses in behavior. Behavior equals communication. This is one of the most important mindset shifts in trauma informed care. All behavior has meaning. Behavior is not random. Behavior is not manipulation. Behavior is not simply noncompliance. Behavior is communication. When someone doesn't have the words, the safety, or the ability to express what they're feeling, their behavior speaks for them. Now let's pause and reflect on common reaction. Instead of thinking they're being difficult, we can shift our way of speaking and thinking to say, what is the behavior trying to communicate? Instead of saying they're non-compliant, you could say, what need is not being met? Instead of saying they're attention seeking, you might say, what might this person be feeling right now? Why does this matter? When we label behavior, we shut down curiosity. But when we get curious, we open the door to understanding. The shift helps us reduce power struggles, increase empathy, respond instead of react, and build trust and safety. Instead of asking, how do I stop this behavior? We ask, what is driving this behavior and how can I respond to that need? When we learn to see behavior as communication, we stop asking what's wrong with this person and start asking what happened to them and what do they need right now. Historically, systems have found on control, managing behavior, and enforcing compliance. Trauma informed care shifts the focus to understanding. Instead of asking, how do we control this? We ask, what's behind the behavior? Traditionally, the focus was on control. Trauma informed care focuses on collaboration. Traditional trauma care focuses on compliance. Trauma informed care focuses on connection. Traditional focuses on authority. Trauma informed care focuses on partnership. Let's look at trauma informed care and five core principles. These are not just ideas, they are practices we bring into every interaction. Safety. Safety is the foundation of everything, and it's not just physical safety, it's emotional safety too. Ask yourself, does this person feel respected? Do they feel judged or understood? Something as simple as your tone or voice, your body language, or how you approach someone can either increase safety or take it away. When people feel safe, they can regulate. When they don't, they go into survival mode. Trustworthiness. Trust is built through consistency. That means doing what you say you're going to do, being clear about expectations, and avoiding surprises when possible. For individuals with trauma, unpredictability can feel unsafe. Even small follow through matters. Every kept promise builds trust. Every broken one reinforces fear. One of the biggest impacts of trauma is the loss of control. So, one of the most important things and powerful things we can do is give it back. This doesn't mean giving unlimited options, it means offering appropriate choices. For example, would you like to talk now or in a few minutes? Do you want to sit here or somewhere quieter? Choice restores dignity. Remember, choice reduces resistance, it increases cooperation. Collaboration. In trauma informed care, we shift from doing things to people to working with them. This means inviting input, listening actively, valuing their perspective. So instead of, here's what you need to do, we say, let's figure this out together. You see, collaboration builds trust and reduces power struggles. Empowerment. Trauma often leaves people feeling powerless. Our role is to help restore a sense of strength and capability. This means focusing on what's working, highlighting strengths, reinforcing progress, and even small wins. So instead of asking, what's wrong with you? We ask, what's strong in you? Empowerment helps people move from surviving to healing. When we consistently apply these five principles safety, trust, choice, collaboration, and empowerment we don't just manage behavior, we create environments where healing can happen. Let's explore practical application. Triggers are reminders of past trauma, but they are not always obvious. A trigger can be anything that the brain associates with a past harmful or overwhelming experience. This means the present moment may be safe, but the body and brain respond as if the past is happening again. Triggers can include a certain tone of voice, especially if it feels harsh or demanding. Authority figures, particularly if past experiences involve power or control. Feeling controlled or not having a choice. Loud or chaotic environments. Even subtle things like facial expressions, body language, or sudden movements. Here's what's important to understand regarding triggers. Triggers are deeply personal. They're often invisible to others, and they are not logical, they are neurological. And here's the key takeaway: language either builds safety or reinforces threat. When people feel safe, their brain can stay regulated. Remember, our job is not to judge, but to recognize. Our role is not to judge the reactions, but to recognize what might be underneath it. Instead of asking, why are they reacting like this? We shift to, what might this situation be bringing up for them? This shift helps us respond with understanding instead of escalation. This work doesn't just impact the people we serve, it impacts you. Let's look at the impact of trauma on staff. When you're consistently supporting individuals who have experienced trauma, it can take a toll, sometimes in ways that are easy to overlook. You may experience secondary trauma, where you begin to absorb the emotional weight of others' experiences. You might notice it showing up as an increased anxiety, irritability, or even feeling overwhelmed by stories you hear. There's also emotional exhaustion, that sense of being drained where your emotional energy feels depleted. Even when you care deeply, you may feel like you have less and less to give. And over time, this can lead to burnout, feeling disengaged, disconnected, or even questioning your effectiveness in your role. These are not signs of weaknesses. They are normal responses to doing deeply human, emotionally demanding work. That's why trauma informed care is not just about the people we serve, it's also about how we support the people doing the work. It means supporting staff well being and essential, not optional, creating environments where you feel psychologically safe, encouraging open conversations without fear of judgment, recognizing when support is needed, making it accessible. Because here's the truth: you cannot pour from an empty cup. When staff feel supported, regulated, and valued, they are better able to create safety and connection for others. So, trauma informed care starts with them, but it must also include you. Here are some helpful tips, do's, and don'ts. Do stay calm. You regulate the room. When you're working with someone who's experienced trauma, you want to validate their feelings and offer choices. Don't take it personally, argue, or use power struggles. Remember, escalation feeds escalation. Regulation promotes regulation. I care alignment. This is where we bring it home. Compassion, it's understanding trauma. Respect is honoring lived experiences. Accountability is how we respond to individuals who have experienced trauma. And excellence is being responsive with consistency. Your role in trauma informed care. Every single role matters. Healing does not just happen in therapy, it happens in hallways, interactions, tone, and presence. Healing happens in relationships, and you are part of that healing process. Trauma informed care is not something we do, it's how we show up.